Hello, I'm Don Walker, and I'm Communications Director for Brevard County Government, and I'm also Public Information Officer for Brevard County Emergency Management. We're here today to provide you a update on the COVID-19 pandemic and talk about some other issues that we're looking at and working on in the county. I've got a panel here with me today. I have Matt Wallace, who is our Public Safety Director. I have Maria Stahl, who is the Administrator of the Florida Department of Health office in Brevard County. I have John Scott, who's the Interim Emergency Management Director. And I have Chief Mark Schomeyer with Brevard County Fire Rescue. So for an update on the COVID-19 pandemic, I'm going to turn it over to Maria Stahl.
Hi, good morning, everyone. I'm Maria Stahl. I'm the Health Officer and Administrator of Florida Department of Health in Brevard County. To give everyone the statistics for today, we currently have 4,658 cases in Brevard County, and that is an increase of 97 cases since yesterday. Our labs reported out, and it's actually yesterday's cases, reported out at a 9.9% positivity rate. Overall, we're now at a 7% positivity rate. The deaths, we did increase by 2 deaths, unfortunately, in Brevard County. And I do want to express my condolences to all the families of the residents that have passed away. Sometimes we sit up here and we talk numbers, but the numbers truly are people. We've had 60 total deaths. 24 of those deaths are related to long-term care facilities. Currently, we have 42 facilities that have cases of COVID in them. Our hospitals right now are doing good and stable. They're busy, but they're stable. Our current bed capacity amongst all of our hospitals in Brevard County is 22.7%. ICU capacity is 19.16%. To give everyone a little bit of a comparison since the first of the month, on July 1st, we had 1,962 cases. So that is an increase of 2,598 cases since July 1st. On July 15th, we had 3,725 cases, and that's an increase of 835. Our deaths, July 1st, we had 17 deaths, and 3 of those were related to long-term care. July 15th, about a week ago, we had 39, and that was and also 11 in long-term care. So we are increasing in our deaths. Our death ages stayed the same. The age range of the deaths in Brevard County are ages 56 to 101. Labs reported out last that our labs generally across all the labs were taking 7 to 10 days to report out. That has decreased slightly. Our labs are now reporting out in 5 to 7 days. Current population tested this month so far is 5% of our population. We do have a goal of 2% to report out, and we've reported out 5%. Overall, about 11% of our residents have been tested for COVID-19. Lastly, I just want to thank everyone for everything that you're doing to control this pandemic and continue to stay home when you're sick, wear masks when you're in closed places and when social distancing is not possible, maintain your social distancing of 6 feet when possible, avoid crowds, and practice good hygiene, hand hygiene. Thank you, Don.
I should mention that we're all social distancing here on the panel today. We're wearing our face mask. I know it's inconvenient to try to talk with a face mask on, but we are making sure that we're following the CDC recommendations. And I also wanted to mention that we have our social media specialist, Jessie Ray, with us today. She is monitoring the Facebook Live feed and taking your questions, and we will attempt to answer some of those at the end of this presentation. So up next, I have Matt Wallace, the Public Safety Director, who's going to talk about some other activities that are taking place right now.
Thank you, Don. And again, my name is Matthew Wallace. I'm the Director of Public Safety for Brevard County. I would like to thank all of you for joining in with us this morning. One of the key components I believe government does is to present information to the citizens so we can make informed decisions and make those decisions in the best interests of your family and loved ones. Communication and information is probably the strongest weapon we have in this fight against COVID. So we want to make sure we take every opportunity to provide as much information out to the public as we can so we can make those informed decisions. So thank you for joining us this morning. I would briefly I'm going to discuss two county commission approved programs that were recently passed. I'm going to go over in just kind of the highlights of both of them. And then we're going to walk through where you can find that information online. So if you bear with me for a few seconds, I'll talk about both of them for a second, and then we'll do the demo online. The first program that the County Commission has approved is a Small Business Personal Protective Equipment Program. This program is going to be targeted to businesses across Brevard County that have 25 or fewer employees. And we just added a couple categories, a category to those list of eligible businesses. Those businesses include healthcare, retail, which is the category that we just added, childcare services and youth camps, museums and historical sites, amusement and recreation centers, independent restaurants, barbershops, beauty salons, nail salons, and personal care services. So if your business is in one of those categories and you have 25 people or less, you will qualify for the PPE program, which includes we will be providing 200 procedural masks, 25 reusable cloth masks, 2 boxes of gloves, approximately 200 gloves, latex rubber gloves, and 2 8-ounce bottles of hand sanitizer. So you might ask, well, how can I apply to the program? Well, we'll get to the website here in a second, but the website went live on July 20th, and it's going to go through July 31st. The application period will end on the 31st. And we will begin to distribute those PPE kits on Monday, August 3rd. We will have locations throughout Brevard County from north, central, south, and beach locations, and then a location at the end of the week on August 7th if the businesses were unable to pick up their PPE supplies earlier in the week. And again, we'll get to the website here in a second to show you how you can apply for this program and be involved. Our second program that the County Commission recently approved is their Small Business Economic Relief Program. This grant program will provide upwards of $10,000 to small businesses in Brevard County that were impacted by COVID. The eligibility criteria for businesses is one small business or nonprofit organization designated under Title 26 of 50C3, 50C6, and 50C19. And must be physically located in Brevard County and legally operate in Brevard County as of 1 January of 2020. Applicants must have 50 or fewer employees as of 1 January 2020. Applicants must have been negatively impacted financially by COVID-19. Small businesses must have a 2020 or 2021 Brevard County tax receipt. Nonprofits must have a designation under Title 26 of U.S. Section Code 501c3, 501c6, 501c19 under the U.S. Internal Revenue Code. Applicants must be enrolled in the U.S. Department of Homeland Security E-Verify program. And applicants' revenue losses or expenses utilized to establish program eligibility and grant amounts must not have been reimbursed through other programs. So we will be targeting those businesses. The application period will go live on July 27th, and it'll last through, the application period will last through about August 10th, through August 10th. We estimate that the review process to review those applications will probably take between 4 to 6 weeks before we will be able to turn those funds back to those businesses. So if I could, Logan, could we cut to the website and we can show? So if you're interested in any of these two programs, the best thing to know is the website to get to, and it is brevardfl.gov. And that website should come up on the screen now, and you should be staring at the website that looks on your screen. In the middle there, with the big red, scary-looking virus, the Brevard Cares resources. If you click on the hot link at the bottom of the picture, it'll take you to the Coronavirus Brevard Care Resources information page. On this page is where you'll be able to find all the programs the county currently has that we will be supporting the community with. I'll let Don talk about some of the other programs, but I will focus on the Small Business Economic Relief Program, and let's get down to the PPE program first, the one that is active. The red block on the left talks about the program. The block on the right is some of the frequently asked questions and the eligibility criteria for the program. And you simply click on Apply Online on this hot link that the cursor is around. Click on that link, takes you to the application page, and welcome to the Brevard County Participant Portal. You register for the page, and then it'll take you to the application. And unfortunately, I did not register this beforehand. But please register there, and that'll take you back to where you need to be. Let's go back to the brevardfl.gov. Logan, can you take me back to brevardfl.gov? If we can't. Wait, we got our social media specialist. Technology is our friend. Look at her. She is awesome. I can X out of anything you need me to do. Thank you for bearing with us. That one right there? I can. I thought I could. Let's see if we can get this going. There we go.
All right, take me to the search bar, please. Cancel out of that.
Cancel out of that.
Click on the search bar.
See, I graduated from college in 1992, and I can still learn how to be a technical. There we go. Okay, we're back. Some technical shortcomings on my part. Again, you go back to the Brevard Care Resources. You scroll down with all the programs on the left, and then we have what we have available currently for the Small Business Economic Relief Program in the green block. When the program goes live on July 27th, there will be a link there to apply for the program, and then you'll be able to walk through all the great things that we're doing as part of that. Don, would you want to talk about some of the other programs that Brevard County citizens are eligible for?
Sure. So Matt mentioned the PPE program and the Small Business and Nonprofit Economic Relief Program. Also on that same page, we have other funding available for rental and mortgage assistance, utility and security fees, and for food stability. So if you need assistance in any of those areas, that's where you can apply. Millions of dollars have been set aside for those programs. So please take advantage of them if you need the help. One of the things I wanted to mention too is a couple meetings ago, the county commissioners approved a proclamation where they're strongly encouraging businesses to post at their entrances whether they are face mask required or face mask not required establishments. That way their patrons, before they walk in, will know what type of business practices that they're catering to and whether they feel like it's safe to go in there. These are available on the county webpage as well. And for anyone that applies and qualifies for a PPE kit, these placards are included in those kits. And so we strongly encourage you to put those at your business's entrances. I wanted to mention, too, that the county doesn't have a mandatory mask requirement, but we have strongly encouraged people, as the CDC recommends, for people to wear face masks. And one of the campaigns that we conducted from the county standpoint to encourage mask wearing was a campaign called Mask Crusaders, where we asked residents of the county that wear masks to send us pictures of themselves wearing those masks and just to tell us why. We had an overwhelming number of folks participate in that program. That program ends today, but it was highly successful. There were times it got political, but there's a lot of people out there that don't believe you should wear masks. But we just want people to follow the CDC recommendations, and we think that that's the safest way to go. With that, I'm going to turn it over. Our first responders are on the front line of this pandemic, and I'm going to turn it over to Chief Mark Schillmeyer for an update from Fire Rescue.
Hey, thanks, Don. In terms of Brevard County Fire Rescue, the overall health of our organization is doing very well, considering the extent of the pandemic. We are encouraging our people to wear PPE, not on calls, but in and around the station and in public. That program has worked to keep our people safe. In terms of PPE, we've had no issues gathering PPE. Emergency management has helped us tremendously in getting the amount of PPE that we need. Obviously, running the amount of calls that we do every day and transporting the amount of patients we do go through a lot of PPE each and every day. And so having a robust supply of PPE is important to us. In terms of the amount of COVID positive patients, potential COVID patients, and probable COVID patients that we're transporting a day, on average is about 20 to 22 of those patients. Ms. Stahl had mentioned that 42 nursing long-term care facilities are affected by this, by COVID, and it seems like a lot of those transports are coming from those facilities themselves. And so our folks are taking extra caution when transporting these sickest of the sick people, which brings up our decontamination and sanitizing program that we have for all of our ambulances. We have 30 ambulances countywide, transporting about 52,000 patients a year. So that decontamination and sanitizing of those units is important, not only for the health of our employees, but for the patients that we transport each and every day. Also, with the probable delay of the school year, Brevard County Fire Rescue is looking at possibly extending the seasonal coverage of our lifeguarded beaches. That will come out shortly. So when the kids and the families are staying home, they want to go out to the beach, we want to make sure that we cover them until the school year starts. I do want to, before I close, reiterate, please practice hand washing, proper hygiene, socially distance, wear face masks, and avoid large gatherings like Ms. Dahl had said. That's all I have.
And like our first responders, our emergency management department is at the forefront of this pandemic and our response to it. I'm going to turn it over to our interim emergency management director, John Scott, for an update.
Thank you, Don. In addition to all that we're doing to support both our first responders out in the field and our healthcare providers and long-term care facilities and our friends at the Department of Health, we also have a couple other things on the horizon that we're working towards at the Emergency Operations Center. Next week, on the 30th of July, we have a very exciting launch opportunity coming. NASA is trying to return a rover to Mars. It's the Mars Perseverance launch. The window opens at 7:50 in the morning and runs through 9:50 that morning. If, for whatever reason, we cannot launch on the 30th, the window for launch opportunities extends all the way through August 15th. And again, this is an important launch because we want to get back to Mars. We want to continue to explore Mars. But it's also a notable launch because it does have a radiological power source for the Mars rover. So I want to talk a little bit about what we're doing to make sure we are taking all the appropriate steps necessary. So if you're not familiar exactly with what this is, let me give you a little background on radiological launches. They've been around for about 60 years. They've been used on 27 different missions throughout those 60 years. They date all the way back to the Apollo missions. I mentioned Mars Curiosity in 2011. This is a very similar mission to that. It's on a very safe rocket, which is the Atlas V. And the radiological source is the battery they use to power the rover because it's a good, strong, reliable source while on Mars that has very few moving parts, so it's less likely to break while it's on Mars doing its scientific mission. We have been planning with our friends at the Department of Energy and NASA and numerous federal agencies and state agencies and regional agencies since about 3 years ago. So the 30th represents a big landmark for us because it's the culmination of a 3-year effort. We've done a multitude of exercises and dress rehearsals, walking through every possible scenario to make sure that we're as ready and able to respond as quickly as we would like to. And so as we go through that, we're actually increasing our footprint at the EOCs. We're activating more partners. We're activating earlier than we would normally, so we'll be activated 4 hours before the launch. Again, just to make sure we've got everything in place. But our expectation is it's going to be a good morning for a launch. We're going to see another fantastic launch from the Space Coast and continue to work our operations.
Thank you, John. John, we're also a good month now into hurricane season. Anything you'd like to report on hurricane season?
I would. Thanks, Don. So as we're getting ready to, August, September, and October are our peak season. You're seeing that now in the Atlantic as you're seeing the Atlantic season begin to heat up a little bit and you're seeing more activity. So it really is a good reminder that this is sort of the last couple weeks you need to make sure your plans are solid, that you've got everything you need in your disaster supply kit, your food, your water, any medicine, any personal hygienes. That if you live in a place, if you live in a structure that is vulnerable to high winds or is a flood-prone area or is in a storm surge zone, you really need to evacuate for these things, and making sure that you have a destination to go to. I mean, we always encourage people, friends and family first. That's where you're going to be most comfortable. If you have the means, you can go to a newer hotel. And then, of course, if you don't have those things, we have shelters available for folks. And again, I want to assure everyone, we are taking all the precautions we can in our shelters. When it comes to COVID precautions, there will be extra space for people. Everyone will have personal equipment, face coverings. We'll be doing temperature checks. We're doing as much as we can to keep people as safe as we can during these times. But like we've talked about previously, hurricanes don't recognize that there's a pandemic happening. And we still have to take all the same precautions we would normally do if this were a regular hurricane season. So please, make sure you have a kit. Make sure you have a plan on where you're going to go. One of the things we talk about in emergency management is if you have a thought about where you're going to go, that's an idea. But the minute you write down where you're going to go, you have a plan. And that writing it down makes a big difference, because that way you're not trying to work it out in real time. You just know, okay, I've got to go implement my plan. So we encourage everybody to do those things.
Thank you, John. There's a lot of information on how to prepare for hurricane season on our website under Brevard County Emergency Management. And we also have a social media campaign on hurricane season preparation. We put out information 3 times a week, new information on preparations, how to be prepared, do you need to evacuate, and all kinds of tips about being ready for hurricane season and being ready to respond when Brevard County shows up in that cone of silence. Excuse me, I always say cone of silence, cone of uncertainty. And you can follow us on social media on Twitter at Brevard EOC, or on Facebook at Brevard County Emergency Management, or at Brevard County on Facebook, and I'm forgetting Brevard County
Gov.
On Twitter. So, all right. So during this discussion, Jesse Ray has been gleaning questions off of Facebook. Jesse, do we have any questions we need to answer?
We have just one clarification. John, you talked about the launch a little bit, and you said that we're activating more EOC partners. Can you kind of talk about what an EOC partner is and who they are?
Sure. So when I talk about EOC partners, this is our first responder and emergency management community. So we're talking about law enforcement, fire rescue, Department of Health, Florida Department of Transportation, Florida Highway Patrol, our Housing and Human Services folks who help with sheltering, our folks in communications here with us today who do our social media and our public messaging. It's all of those people who perform a very specific function during any sort of emergency, so that if there is a problem, we already have the staff ready to go and they're trained on what the response needs to be. Does that help?
Yep, that's perfect. Thank you very much. Don, would you mind kind of going over some of the testing sites that are still available that people can go to if they are symptomatic or asymptomatic, and how they go about doing that?
Sure. Well, they have the state testing site that's located on the campus of Eastern Florida State College at the Palm Bay campus. And that's open daily from 9 a.m. to 5 p.m. No appointment necessary. The tests are free. Health First at Pro Health and Fitness on Merritt Island, Borman Drive. They have testing from 9 a.m. to noon, Monday through Saturday. To call there for an appointment, it's 321-434-3131. Paris Hospital is asking for pre-registration for their testing locations. If you can call 321-268-6139 or 321-204-1699. And the Department of Health Brevard has free appointment only drive-through testing locations, and you need to schedule an appointment at 321-454-7141, and that's every Monday, Wednesday, and Friday from 9 a.m. until noon. So those are some of the locations.
Hey, Don, just a clarification. Department of Health is doing Monday, Tuesday, Wednesday, Friday.
Okay. Bad
Sorry,
information.
that was on me.
Okay, so John, repeat that one more time.
Yeah, so again, just the Department of Health, again, they are doing it by appointment, as you mentioned, at their Vieira Clinic, and it's Monday, Tuesday, Wednesday, Friday.
Okay. Couple more questions?
No, I think that's really all we have as far as questions go.
Okay. So thanks for joining us today, and we do want to remind people again, please wear a face mask, follow the CDC recommendations on social distancing, hand washing, avoiding large gatherings, and stay safe. Thank you very much.